Hello everyone, and welcome to the last video in this series, and this is on fluidotherapy. This will be very brief. This is sometimes called a dry whirlpool, and basically you can see the type of machine. There's a machine, and within this machine are some cellulose particles, and basically just ground up stuff like, kind of sawdusty kind of material, and it goes into the tank here. And the person generally uses their arm, but theoretically you could put your foot in as well. And the Velcro is to keep the cellulose from flying all over the place. And then generally warm air blows through the unit, and it's a form of heat modality that heats the body by conversion. So that's what we're going to talk about today. All the physiological effects are the same as heat, and so again there's our cellulose. So advantages, the patient can certainly exercise while they're in this application, and there's really no pressure on the treatment area, so unlike a hot pack, you don't have any force or pressure on the area. Unlike whirlpool, there's no water, there's really no cleanup. You can set the temperature very precisely, and of course along with the treatment time, and you can see you can adjust airspeed as well. But it's very nice, also cleans your jewelry really well, but it's very easy to regulate. The initial expense for the equipment is fairly expensive, but you'll have it forever. It'll be for a long time. Now often the body part is in a dependent position, as you can see in this slide here, but this one the height of the unit is adjustable, and so in this case the person would not have to be in a dependent position. And then the only thing you have to be careful of really doesn't have anything to do with giving the treatment, but those cellulose particles, it can get on the floor, and if it's a tile or a linoleum kind of floor, it can be very slippery. And if you've ever been to a dance where they put like the dance sawdust on the floor, it's very much like that. And so just have to exercise caution around the equipment and make sure that there's nothing for a fall risk. So we'll just briefly go through indications, precautions, and contraindications. Our favorite, subacute and chronic, traumatic and inflammatory conditions. And we do tend to see this done primarily in occupational therapy settings where the person is maybe had hand surgery or has a wrist or other distal arm problem, maybe carpal tunnel syndrome, something like that, where they need to increase, strength and flexibility, decrease pain, things like that. We can also see this done in conditions where the person has developed a hypersensitivity condition, and we're going to talk about this. There's a whole constellation of problems called chronic regional pain syndrome that can develop in the hand or in the foot after, again, surgery or fracture or other injury. So this can be a way to the flow of the cellulose particles on the skin can be a way to desensitize and to provide pain relief. And then it might surprise you to know that you could do this for open wounds. You cover the wound so it doesn't come out all clogged with cellulose particles stuck all over it, but if you cover the wound, then you get the benefits of increased blood flow and pain relief without the disadvantages of maybe excessive maceration of the skin or too much moisture or the negative effects of that turbulence on healthy tissue. And then finally contractures, of course, for the heat to increase flexibility, and the person can exercise while they're in the unit. Precautions, no surprise there, patient confusion, edema, and PVD. And then the contraindications, again, all very similar to what we've talked about before for heat conditions. So we wouldn't do this for an acute condition. If someone has fever or an infection, cancer, we wouldn't apply this treatment if they had active bleeding or if they had cardiac insufficiency. So unfortunately, since we're not taking a trip to Beloit Memorial Hospital, you won't get a chance to play with this. Again, I think it's pretty rare that you would actually be administering treatment, as it tends to be almost exclusively used for the upper extremities, but always something to keep in mind. So if you had a patient that might benefit, you might bring that up and perhaps refer that patient to occupational therapy if you in physical therapy didn't have access to this equipment. All right, that was a short and sweet one, and I hope you have fun playing with the whirlpool and doing all the other heat and cold modalities in lab. See you soon.